There was no significant change in the thickness of hair. Hair softness. The scale mentioned below was used by dermatologists to assess the hair texture in terms of smoothness, roughness. Scale: 1 equals very rough hair, 2 equals rough hair, 3 equals average hair texture, neither rough nor smooth, 4 equals smooth hair, 5 equals very smooth hair. Table 8, Figure 5, Figure 6. Table 8, Assessment of the hair texture. Figure 5, Hair softness. Figure 6, Scalp condition. After 30 days of test product application, visit 2, significant improvement in hair texture, that is, softness, was observed in comparison to baseline, and it continued till the end of the study. Scalp condition, Table 9, Figure 7. At baseline, 91.18% of the study population already had normal scalp, which increased after 30 days of product usage to 94.12% of the study population had normal scalp. Table 9, Scalp condition analysis. Figure 7, Scalp condition statistics. Result observed. There was no significant change noted in the thickness of hair at any time point of the study. However, there was a significant improvement noted in hair texture, that is, softness, at day 30 in comparison to baseline, and it continued till the end of the study. At baseline, 91.18% of the study population had normal scalp, whereas after 90 days of product usage, 94.12% of the study population had normal scalp. Image analysis, Table 10. Significant improvement was noted at the end of the study as per the image analysis. The improvement was noted in 16 subjects, out of 34 subjects at the end of the study. Table 10, Improved statistics as per the image analysis. Result observed. Significant improvement was noted at the end of the study as per the image analysis performed by dermatologists based on the provided scale. Out of 34 subjects, the visual improvement was noted in 16 subjects with continuous usage of test product at the end of the study. Figure 8. Figure 8, Image analysis. Instrumental measurement. Hair tensile tester and corneometer was performed on all the visits of the study to determine the efficacy of test product in hair strengthening and providing the hydration to the scalp. Hair tensile strength. Tensile test was performed to determine the strength of hair when subjected to force until hair breakage, and it was done on all visits. Table 11, Figure 9. Table 11. Determination of the strength of hair using hair tensile strength. Figure 9, Hair tensile strength. With continuous application of test product, significant increase in hair tensile strength was observed at day 30 and day 90 in comparison to baseline. Tensile strength increased by 33.80% at day 90 in comparison to baseline. This infers that the test product improved the hair tensile strength. The hair tensile strength was approximately 1.34 times higher at the end of study over baseline. Results observed. With continuous application of test product, significant increase in hair tensile strength was observed at day 30 and day 90 in comparison to baseline. Tensile strength increased by 33.80% at day 90 in comparison to baseline. This infers that the test product was efficacious in the improvement of hair tensile strength. A slight increase in the value was noted at the end of the study in comparison to baseline, but the change was not significant. Throughout the study there was no difference in scalp hydration level. With continuous application of the test product, about 60% of the study population had hair fall less than 30 strands, about 80% of study population had normal and soft hair, and 8.82% of the study population graded that their hair volume was good at the end of the study. Corneometer, Table 12, Figure 10. Corneometer was used to determine the hydration of the scalp. It was used on all visits of the study. The probe of corneometer was placed on the intersection of horizontal and vertical section of the scalp. An average of 3 measurements was considered for the analysis at each point of the study. Table 12, Final determination of the hydration of the scalp using corneometer. Figure 10, Corneometer test to determine the hydration of the scalp using corneometer. Post 90 days of product application, slight increase was noted in the hydration level in comparison to baseline, but it was not found to be significant. Throughout the study there was no difference in scalp hydration level. Subject self-assessment. The subjective self-assessment was performed to determine the product's efficacy after the application. Subject self-assessment was performed on all visits. Current hair fall rate, Table 13. At baseline, 41.18% of the study population had hair fall more than 50 hair strands, and 58.82% of the study population had hair fall more than 50 hair strands. However, after 90 days, visit 3, of product usage, none of the subjects had hair fall more than 50 hair strands, and 67.65% of the study population had hair fall less than 30 hair strands. The test product received positive response. Table 13, the hair shedding grades before using the test product. Current hair texture, Table 14. At baseline, 23.53% of the study population perceived to have rough hair. However, after 90 days, visit 3, of product usage, 5.88% of the population perceived to have rough hair. About 65% of study population changed their perception from rough to normal and soft hair after application of test product at the end of the study. Table 14, Hair texture grading after the usage of test product. Current hair volume, Table 15. At baseline, 32.35% of the study population perceived to have less hair volume, and 67.65% of the study population perceived to have average hair volume. After 90 days, visit 3, of test product usage, 2.94% of the study of population perceived to have less hair volume. 88.24% of the study population perceived to have average hair volume, and 8.82% of the study population perceived to have good hair volume. Table 15, Hair volume grade after the usage of test product. Merits is about product, Table 16. 17.65% of the study population liked color, texture, fragrance and felt that it was easy to use, and also, 32.35% of the study population liked the fragrance of the test product. Table 16, Merits of the test product in terms of color, texture, fragrance. product effectiveness in reducing hair fall, Table 17. 67.65% of the study population felt that test product was efficacious in reducing the hair fall. Table 17, effectiveness of the test product after its usage. Demerits about the product, Table 18. About 76.47% of the study population did not mention any parameter which they did not like about test product. Table 18, demerits about the test product. Safety assessment, Table 19. Dryness, at baseline, 2 subjects had mild dryness which continued in one subject and resolved in another subject on next visit, that is, day 30. At the end of the study, none of the subjects had any dryness. Table 19, safety assessment of the product. Scaling, at baseline, 9 subjects were noted with mild scaling which resolved in 3 subjects and further continued in 6 subjects when evaluated on next visit, that is, day 30. On day 90, mild scaling resolved in 4 subjects but continued in 2 subjects. None of the subjects had erythema, folliculitis and allergic reactions. Table 20. Table 20, safety assessment of the product. Burning sensation. At baseline, 1 subject perceived mild burning sensation and it resolved on next visit. Itching. 20 subjects perceived itching where 11 subjects perceived mild itching, 7 subjects perceived moderate and 2 subjects perceived severe itching at baseline, that is, before application. At day 30, 8 subjects perceived mild itching, 1 subject perceived moderate itching and none of the subjects perceived severe itching. At last visit, day 90, 3 subjects perceived mild itching and none of the subjects perceived moderate itching. Oiliness. At baseline, 6 subjects experienced mild oiliness and 1 subject experienced moderate oiliness. At the end of the study, none of the subjects experienced oiliness. None of the subjects experienced boils on scalp during the study period. Conclusion. From the above results, it can be concluded that the test product was efficacious in reducing the hair fall and hair breakage when subjected to comb and hair pull test with the results of 49.26% at 90th day. Hair texture and scalp condition was improved up to 91.18% and 94.12% respectively. Image analysis showed that out of 34 subjects, the visual improvement was noted in 16 subjects with continuous usage of test product at the end of the study. Hair strength and scalp hydration tensile strength increased by 33.80% at day 90 in comparison to baseline. With continuous application of test product, about 60% of the study population had hair fall less than 30 strands, about 80% of study population had normal and soft hair and 8.82% of the study population graded that their hair volume was good at the end of the study. It was found that the test product was able to nourish the scalp and resulted in healthier hair, with improved hair tensile strength and hair quality. The test product was overall safe and well tolerated.